Good morning. Welcome to the Latino Health and Research and Policy Conference Day. We're really, truly excited to have you here. My name is Fernando Holguin, and on behalf of the LRPC team, welcome. This is really a very special day for us for a number of reasons. Suffice to say, we have a really exciting agenda, and we have a group of really very talented speakers that are going to be talking to you today about a lot of relevant issues that are important for the Latino community. So make yourself at home. A couple of housekeeping issues. At lunch, we're going to migrate back to the place where you were at breakfast. I think the restrooms are also located on that side if you need to. So let us know what we can do to make your stay here more comfortable. With that, I would like to introduce Don Elliman, who's our Chancellor. Don, thank you so much for being here and giving some introductory remarks.
Thanks, Fernando. I'm not part of the exciting agenda. That's to follow. I'm the warm-up act. I'm really here just to say welcome. I have the honor of being the Chancellor of this campus, and it is an honor for me to serve in that capacity. And I'm passionate about the missions that we have on this campus, one of which is represented by the LRPC. It's an incredibly important organization to us because we recognize the issues of health disparity and inequity in the Latino community. And we believe that we have a meaningful role to play, to try to play, with many partners to address those needs. And in today's climate, that's obviously getting harder and harder and harder to do. So I hope that today goes. The LRPC, by the way, is 20 years old. It's now part of the School of Public Health, which is only 10 years old. So I guess if you do the math, for about half of its life, it's been part of our Colorado School of Public Health. And I think that's a powerful partnership. The School of Public Health deals with issues that are central to the Latino Research and Policy Center. And I think together with you all, hopefully, we can make a difference. We were very lucky in the Colorado School of Public Health to attract a new dean recently, about, 5 months ago? How many? 6 months ago. It only seems like 5 months ago. We attracted John Samet to join us from the University of Southern California. He is a leading force in public health in America today, and we are, and I say blessed to have him as our dean. He, if you don't know, is responsible for a school that isn't just the University of Colorado. It's a consortium with CSU and University of Northern Colorado, so it's a unique educational institution in the state. It's only 10 years old, and it's already risen into the ranks of the top public health schools in the country. So without further ado, I'm going to turn it over to John Samet. Thanks very much, and I hope you have a wonderful day.
Just for disclosure, I'm not Dean Samet. So as Don mentioned, the LRPC has been around for 20 years. I was recruited to sort of direct the Latino Research and Policy Center about 1.5 years ago when I moved from the University of Pittsburgh. And it's really been a truly fantastic experience. And over this time, I've met a lot of really wonderful people in the Denver community. And so it's really been just a great part of what I do here in Colorado. So I wanted to give you today just a little bit of a brief introduction of what the LRPC has been, and I think more importantly, give you sort of a sense of where we want to take the center sort of in these next phases. As Don mentioned, this has been going on for around 20 years, now in the Colorado School of Public Health. And the mission was very simple, which was to sort of really increase the collaboration with community-based organizations and academic institutions with the ultimate goal of eliminating health disparities in the Latino community. And I think since its inception, the LRPC has done extremely well to work addressing some of the Latino health issues that are important. So the LRPC primarily has been sort of a research center, and over the years has had multiple grants that are funded from community-based organizations, foundations, as well as federal agencies. So the LRPC, in that process, has developed a very strong network of collaborators that we continue to work with. And currently, our research agenda is growing, and we have two large projects. One's a PCORI project working with Latinos with head and neck cancer, and a recent large project funded by the CDPHE on cervical cancer prevention, both of them which are headed by Evelyn, which is our associate director in the center. And we're also moving into looking at environmental exposures and asthma and other factors that relate to respiratory morbidity. So happens to be I'm a pulmonologist, so that's a clear direction, I think. But that particular project, for example, as others, are really in response to what the community wants us to be doing. So this is really a great way of doing research. What we do and what you do is really clearly important, has a lot of really public health implications. For one, and this is something I learned when I moved here, I really wasn't aware, but the Hispanic or Latino community in Denver is really the largest minority. So if you look at that, in Denver, it's about 31%, 21% in Colorado, this is 2014, and these are clearly larger than the national average of Latino population. So it is a really large part of the population, and so whatever happens in the Latino population matters from a public health perspective. In fact, if you look at the Pew Research Center, the metropolitan area, including Denver, Aurora, and Lakewood, it ranks 16th in the nation in terms of the Hispanic population. So clearly quite remarkable. 1 in 5 Coloradans is Hispanic, so over 1.2 people in the state, of which the majority of them are from Mexico. Interestingly enough, once you get a sense of working in the hospital and the community, then people from Mexico happen to be the majority from the state of Chihuahua, which I found it really fascinating how these sort of channels of different states, people are laughing because there's probably a few Chihuahuenses here in the audience. So it's a very interesting mixed population, Hispanic. I would say that, unfortunately, as a minority population, the Hispanics are at risk of many health problems and chronic conditions. So, for example, if you look at the Center for Health Progress data from 2017, Latinos are twice as likely to live in poverty, are almost twice as likely to be uninsured, and are more than 3 times not as likely to have a high school degree. More importantly, about 23% of Hispanic or Latino Coloradans are in poor or fair health compared to other Coloradans. So clearly a lot of work that needs to happen. Importantly, so disparities have a lot of different sort of broad range of factors, and one of them is healthcare delivery. And so compared to white Coloradans, Hispanic Coloradans have less access to a lot of important preventive health, like mammograms, cholesterol check, colonoscopy, flu vaccination, and you would also add some of the work that's been done in the School of Public Health about smoking cessation services that are less to Latinos that smoke. And these are just a few examples. As many of you know, Latinos are at higher risk of developing diabetes. The prevalence of obesity is greater in the Latino population compared to white Coloradans, particularly in kids. So depending on the statistics that you look at, kids are 2 to 3 times more likely to be overweight or obese compared to white Coloradans. And this is a major problem because it leads to diabetes, which is highly prevalent in this population. A lot of it, as you can see here, comes from also from different reasons, but sort of poor or high-risk behaviors, such as poor dietary intake and lack of exercise. So just to illustrate that, if you look at maternal child health indicators, health and risk behaviors, infectious diseases, health and care access, the disparity, which is on the right side of the column, which is in red, is worse in Latinos compared to all Coloradans. Except, not everything is bad. And I think it's important to point out that some health statistics are better in Latinos. For example, Latino women are almost half as likely to smoke or drink during pregnancy, and they have better control on hypertension. So what I find fascinating is that in spite, sometimes you look at the statistics in the Latino population, and they have less access to insurance and services. When you look at some of the health indicators, seem to be better, and this is called in some places sort of the health paradox, the Hispanic health paradox. So, for example, from the Center for Disease Control, Latinos compared to whites, 35% less likely to have heart disease, and almost half less likely to have cancer. have a lower death rate overall except for diabetes, less smoking prevalence, but there's a lot of heterogeneity here. So Mexicans tend to be much more sporadic, less intensity smokers compared to Puerto Ricans or Cubans. So lumping all Hispanics is sort of dangerous because, we tend to be from different places and it's very different population. As I mentioned, less likely to smoke during pregnancy. And one of the things that I found fascinating, and I had the opportunity to do some of this work when I was at the Center for Disease Control, is the sort of the migration paradox. Because if you look at some of the statistics, when you compare Latinos that are foreign-born that are living in this country to those that are first or second generation here, those that migrate seem to have less risk of developing chronic diseases such as heart disease, cancer, high blood pressure. I did at Center for Disease Control work on asthma and found out that the asthma prevalence in Mexico is half of what the U.S., but after they migrate, after 10 years or more, they sort of uptake the prevalence rates that are in this country, and that happens for many chronic diseases. So something happens that the protective effect of Hispanic migrants is lost after they come to this country. And I think there's, as much as there is important to really understand what drives disparity, it is also very important to understand what are these protective factors and the resilience that exists in the Hispanic population, because I think there's a lot we can learn from it. A lot of that come from family networks and other things. Over the years, the Latino Research and Policy has done a lot of work in community-based research to reduce health disparities and improve lives, with the idea that a lot of this work, not only that the LRPC does, but the work that you do will inform policy, and through policy we can improve the lives of people, right? So we can inform decisions based on data. Where we want to go next is really to expand the program and build sort of what I call the next generation of Latino health scholars, of the people that are truly going to be doing a difference in the community. And we're also developing a service line that I want to talk to you a little bit. This is very timely because if you look at the Colorado Department of Public Health and Environment, one of the sort of tasks recommendations that they put out a few years ago in terms of what are the things that we should be doing to eliminate some of the disparities are professional education and increased awareness, especially among healthcare providers and public health professionals, about health disparities and the root causes, including social and economic obstacles to health, such as discrimination and limited English proficiency. And I think that our certificate is responsive to this task. So with that in mind, we developed the Latino Health Certificate, which is open and approved by the School of Public Health, to identify and describe health disparities affecting Latinos and demonstrate understanding of the associated determinants of health, identify best practices and effective interventions that can be used for Latino communities, and also be able to locate, use, and critique secondary data sources to report health issues and social determinants of health and their impact. And I think importantly so, this is really a key, is that the work that we do has to be culturally sensitive and appropriate all the time. We, in mind, have developed what I think to be, excuse me if I'm a little bit biased, but a very exciting colloquium. It's a 2-semester program that really takes in many of the factors. If you look at the right of your screen, this is from the National Institute of Health, their sort of view of what drives disparities, and you have a whole set of proximal and distal factors related to individual biological risk factors all the way to systemic inequalities. And so our colloquium is modeled towards that end, looking at the cultural perspective. We have a module on health topics, including diabetes, obesity, substance abuse, mental health. And I have to say that all of the work that's being taught at the colloquium is taught by people that are actually doing work in the community. And so I think the exposure to the students will be not only like, because a lot of it is in the story, how you get there. So to hear from researchers and from community leaders, how they get to where they are, I think it's invaluable to the students. We'll discuss what type of intervention works, what type of interventions don't work, sort of what are the influences around what drives health disparities, what is the healthcare system with Latinos and their disparities, and then a very thoughtful discussion about it at the end. So this is how it works, very simplistically. We are hoping to drive students that are in the MPH, or in the MPH programs, but also students that are in the community, are working in the community, that want to really sort of dive into this issue, to take the certificate and the colloquium, to have exposure to faculty working with Latino issues, and then to gain the necessary knowledge to do basic research in the community and be able to implement and evaluate programs. But we really want to take the program one step forward. I think it's great to have a certificate program, it's great to take classes, but in my experience, nothing beats the opportunity to be out there in the field. So with that in mind, we sort of developed this somewhat emulating what NIH training grant looks like, in which you have your theoretical classes, but then you also spend some time with mentors in the field, and you get to see in real action what community organizations do, and not be something that you do after you finish the certificate, but as you're doing the program. And at the end, I think that students will walk out with the experience in program implementation and culturally appropriate community research. Why I get so excited about this is because I think that this is a long-term commitment to reducing health disparities. And the way it works, in our view, is that we will be able to increase Latino representations in community organizations that are really making the difference and the foundations that are funding these programs. And we want to augment the pipeline of talented professionals working on relevant issues for the community. So is the first class of the Latino certificate scholars going to reduce disparities? No. But eventually, over time, these people will influence other people, and those people will influence more people and will generate the change. The next part where we're heading, this is fairly new, so it's sort of work in progress, but we're developing a service to the community. And this it happened to me one time when we met with a lot of people in the LRPC, and one person asked me, "So what do you sell? What's your product?" And I kind of like stared at the ceiling for a moment. I'm like, I don't know what I sell. And so, we do research, but then people so we wanted to develop a specific line of service to community organizations that I think university does well and has the resources to do it well. So we're developing a research practice partnership, and we're sort of piloting this work with Denver Health, with Rocio Pereira, Servicios de la Raza, with Rudy, whom you hear about, and Vuela with Diana, and other organizations, to develop a sustainable model in which community organizations really build the capacity to manage information. So this really stems from the idea that community organizations receive funding, they do the work, and then they have the data. And data analysis and program evaluation is very complex. And often it delivers a result, but it's not used to sort of build it to the next level and improve their chances of funding. And so I think there's a lot of opportunity in which the LRPC can provide the necessary support to communities to really sort of elevate their game in this arena. So won't go into detail, but a lot of the things that we can provide services to the community are things that we do well here, and we do it all the time. Helping identify the right question and how you measure it. What is the best study design for your question? What is the best way to store, analyze, and present your results? And things that are sort of behind the scenes. You think about community-based organizations, they're with people and the front lines, but there's a lot of process that happens behind. And so that process is key to obtaining funds and to keeping the information flowing. That's what we want to work with. At the end, I think facilitating research or program evaluation to make people do it better will enhance the translation of results into action and ultimately will improve community health outcomes. So this is how it all, now this doesn't happen in isolation, this sort of comes together, and what you have is this part in which we have community-based organizations, you have the LRPC on one side, and you have Latino scholars on the other side. And the way it works is the LRPC helps and partners with organizations to sort of build capacity around data management and program evaluation. But on the other hand, you have these really excited, brilliant students, hungry for work and for data, who are going to participate and catalyze this information and move it to the next step, while they have the opportunity to put their hands in real information. So ultimately, community-based organizations will have the capacity to more effectively improve health outcomes by managing information and program evaluation. And I suspect that through the process of this program development, that many of the students that are working will eventually become permanent parts of the team of the foundations and organizations. And so they will acquire people with experience. So this is our 4 pillars as we are right now moving forward. And I think the educational part, thanks to the support of the leadership, it's a sustainable process. So the program is not going to go away. It's going to continue to grow. The service piece, we're really thinking very hardly about how to make it work sustainable over time with the participation of community organizations. There is no work without team, and I happen to be really just incredibly lucky to work with an incredibly talented and committed group of people: Alice, Alex, Evelyn, Jenny, Kishori, Lauren, Patricia, Samantha, and Susel, and others that have been in the center before. And just really, this is not a group, this is our family, and we're all committed to the same end point. couldn't do anything without the support of the leadership, Don, Dorothy Horrell, the provost, John Salmon, who in 5 months here, we met several times already to discuss the LRPC and where we're going. Sheena Bull, who's been a real true mentor and support of the center since way before I was here, and Elaine, who was the interim dean, who I met with and worked as well on this era. These are all the advisors and affiliate faculty for the certificate program. I want to specifically recognize Patti Valverde and Maria, who are co-leading and directing the certificate. It's a lot of work, a lot more work than I had thought to put one of these together, but totally worth it. We have a list of mentors and projects that are willing to take on students and to help us really pair mentors and mentees in a very productive, fluid way. We've worked with a lot of affiliated organizations since I've came here, and this is just a short example of all the people that work with the LRPC, so thank you so much. And thank you for being here. This is great. This wouldn't happen without your participation, and so I really appreciate your attention and your time. Thank you.